information. We shall now go on to our next speaker, Dr. Deepti, who is an oculoplastic and orbit specialist from Divya Drishti Eye Care Hospital Center, Mumbai. And she is going to tell us something, a freelancer's view when these aspects are considered.
Good evening, everyone. So I would like to, am I audible?
Yes, yes.
So I would like to thank Chitra ma'am, Arvind sir, and Vidya ma'am for giving me this opportunity today. So my topic is completely non-academic. It's my own perspective and my own personal experience per se as an oculoplasty, freelancing oculoplasty surgeon. I'm sure there are many here and they would have a different opinion as well. So I would just share my, is my presentation visible?
Yeah. We should have heard Dr. Vikas Menon, we missed out. Yeah.
Oh, sure. I should continue or?
No, you continue. After that, we'll go back to him.
Okay. So I finished my fellowship from Arvinda Hospital, Madurai, and I came back to Mumbai. That's my hometown in 2014. And when I came back, there was a very different practice pattern which I saw when I came to a metropolitan like Mumbai. There are many private practitioners in Mumbai than the institutes, like dedicated ophthalmic institutes, how we have in South India. And whatever institutes or tertiary higher care centers are there, they are already occupied. In Mumbai or any, I think, metropolitan city, the doctor to patient ratio is also quite high. So what I faced was there was a significant time lag for getting the first attachment or a first surgery when you're fresh out of a fellowship, when you're fresh into a practice, minimum 6 months. So then there are trust hospitals or peripheral centers in the cities where you can get an attachment for starting your oculoplasty practice per se. And what I would advise is at least have one multi-speciality attachment, because being an oculoplasty surgery or being a DCR, you need to have that backup for shifting your patient, or for oculoplasty orbit surgeries, you need to have that backup of a multi-speciality. So these are the things which I learned over a period of time to carry with me always. The own autoclave set of instruments in a sterile instrument in a drum, because you may not be comfortable with somebody else's instrument. Then most of the places, the assistant which you will get is the one who's trained only to assist cataract. They don't have much idea about DCR or oculoplasty procedures, and they don't know how to make nasal pads. So I always carry my own nasal pad, sutures, 60 Vicryl and 60 Epsilon. I always carry bicanalicular stent because you never know who you will have to do it for. And if I have been informed before, if it's a failed DCR or any complicated DCR, then I always carry mitomycin C as well with me. And I carry Surgicel packs. So Surgicells are nothing but a bioabsorbable thrombogenic cellulose sheet, which will help you in arresting the bleeding. I have certain preoperative protocols devised over a period of time after many experiences. So general ophthalmologists, they just do a cataract related investigation, but we have to insist them to do a coagulation profile, ask for the history of blood thinners, and get blood group cross match as a standby protocol for all the patients. I give this preoperative medicine as to all my patients, topical and oral antibiotics 1 day before. Then recently I have been advised by some anesthetists, so I have started giving patients oral tranexamic acid as well, 500 milligram TDS 1 day before. Then I start patient on nasal decongestant like oxymetazoline also 1 day before, and I do give oral anxiolytic, Respil or Anxit 0.25 milligram 1 day before. Now, basic question is how do you carry your instruments, or what do you do about autoclaving sterility? So there are two options. When I was new into the practice, I didn't have my own setup or anything else. So you either have to drop off your instruments to the place where you have to operate. So that's the travel time you save, and or else you have some hospital attachment or some hospital where you can get your set autoclaved. Second is best thing is to have your own setup where you can autoclave whenever you want, and then you carry the sterile set in a drum. Being a freelancer, what you face is a variable size of OTs, variable presentation of OTs, where the table, trolley microscope is usually arranged as per the parent surgeon, who's usually a cataract surgeon according to their preference. So you have to spend some time initially to do that setup. The anesthetist backup has to be there. You have to insist on that. And since you are not the one who has checked the patient before, so you have to do a sac patency test and a probing before you take a patient for surgery. So these are just a few pictures to show how I do my arrangement of OT for DCR. I usually keep the OT trolley where the instruments are there at the head end. The assistant is on one side, opposite side, and I sit on the side of the surgery. And many places, maximum places, I do not have an overhead light source. So I use this microscope. I tilt the head in a way that the light falls in my operative area. And yes, it does give a lot of neck strain. Other option is this portable light source, which if you have a attachment where you do more regular cases, you can insist them to invest into this. Or you buy a loop with a light source. Now, I would like to talk about some pros and cons of freelancing. About pros, that freelancing doesn't require any investment per se. You have to just buy your own instruments, sutures, and everything. The post-op, pre-op evaluation, everything is taken care by the parent surgeon. So you are not you are not investing too much time on that. You get flexible working hours. You can have your own rules and your own timing decided. Then sitting at one place in a one OPD doesn't get you more exposure to cases. Patients are not oculoplasty or DCR patients are not simply going to walk into your OPD. So you get more variety and more number of surgeries if you are in a freelancing setup. And you also develop a networking among your peers. That is how you get references. You meet more people, you meet new anesthetists, and it just expands your world. Now, cons of freelancing are like, as I said, you are not at all much in contact with the patient. It's never your patient per se. So you don't have that patient-doctor relationship. Then it's a time-consuming process to do the OT arrangement and entire setup. It's not like how you would have in an institute where everything is ready. And it takes time to start a case. Then there is a time lag to have an established fixed attachment. You are easily replaceable, obviously. And the traveling time, especially in Mumbai, the expenses you have to account for. And definitely it has lower income potential. So this is my own perspective and my own experience, which I shared. We can discuss about it. I would like to thank you all for the attention. Thank you.
Dr. Deepti, that was a wonderful talk.
Yes.
Purely because I totally understand your pain.
Yeah. No, I also felt she's a very courageous, smart girl. There's a lot of hardship into all this. And, if you're very confident about your content and your surgical skill, I think an oculoplasty surgeon will find himself anywhere. Very good. Very nice.
Thank you, ma'am.